So, HIV self-testing in Vietnam, I wanted to provide first just a little bit of context about why self-testing in Vietnam. Eamon Murphy this morning presented on Vietnam's performance in terms of epidemic control, and there's a lot of positive things to say. As we look at Vietnam's road to 95, you can see that there are still gaps in terms of the first and second 90s, so still work to do there. However, as we look at HIV prevalence, especially among MSM and people who inject drugs, we can see that there is an increase, and we can also see among distribution of new infections projected out to 2025 that there is a growing proportion of infections among men who have sex with men. So there's a very dynamic and shifting epidemic in Vietnam. So now, with that context, I want to take you back in time to before November 2015. So at that time, with a very dynamic, changing epidemic, number one. Number two, HIV services were only provided in the public sector. So that includes for HIV testing. If you wanted a test, you needed to go to a public hospital or a public clinic. The third key point is that over time, through sentinel studies, we could see very low and steady uptake of annual testing among key populations. And studies that were done with different segments of key populations around testing, feedback related to testing reluctance was around concerns regarding confidentiality and lack of convenience of testing offered in public facilities. And then third, if any of you have been to Vietnam, you might have seen propaganda posters that are used for different things, including for HIV. And so at that time, there wasn't necessarily very strong or resonant communications around testing that might inspire key populations to come in for a test. So then, in December 2014, the government of Vietnam signed on to 90-90-90. And that then evolved into 95-95-95. But at that time, because HIV testing was so low among key populations, the Ministry of Health was very open to new ideas, new approaches for HIV testing. And then this offered an opportunity to talk about HIV self-testing and also lay testing. So I'll be walking you through a phased approach of what happened in Vietnam from 2015, laying the foundation for self-testing, through piloting self-testing, boosting demand, operationalizing self-testing at national scale, registering products, and then this evolution, which is underway now and in the future, of different models of self-testing, commercial, pharmacy, online, and others. So starting first, phase one, laying the foundation. So in 2015, the USA Path Healthy Markets Project, Ministry of Health, and community groups implemented a study in 5 provinces using respondent-driven sampling. And as part of the study, we asked about self-testing. So it was theoretical. If you were offered a self-test, blood-based or oral fluid, would you be interested in taking it? And so we looked at intention to use. And so here we found that more than 50% of female sex workers, people who inject drugs, and men who have sex with men were interested in taking a self-test. And then we also asked about blood-based versus oral. What would you prefer? And it was different by population. People who inject drugs, for example, were more likely to prefer a blood-based test. And then we also asked about willingness to pay. If there was willingness to pay, and yes, largely there was, and then at what amount. And so we found variability based on different populations. So all of this information was very useful, and then thinking through a pilot. How would we roll out HIV self-testing? So that leads to phase 2, starting off in 2016. In May 2016, HIV self-testing was offered, and basically it was offered in a couple of different ways. One, we were looking at preference for assisted versus unassisted self-testing. So getting some help with self-testing versus not needing help. And it was implemented through 15 key population-led CSOs in 3 different cities. There was also a choice of tests, so those of you who have tested people before or are familiar with HIV tests, you'll know that Alert Determine is not a self-test, it's a professional use test. But at the time, we really wanted between a blood-based test and an oral fluid test, and there wasn't a blood-based test that was available to us at the time in Vietnam. And so we sort of bootstrapped Determine and made it available in CSOs as a self-test kit, and then used OraQuick for the oral fluid. So then we worked together with the community to develop inserts, posters, and videos to guide use, and then also enable training and supportive supervision. The Ministry of Health, the National HIV Program, was really interested to see how self-testing would roll out, so there was a lot of engagement, which was really fantastic in building their overall understanding and ownership of self-testing. And then lastly, we implemented an evaluation of self-testing, looking at acceptability, feasibility, and also effectiveness in terms of the cascade, from confirmation to treatment. Sorry, I just realized I was standing in front of the slides. I'll stand to the side now. And in terms of Ministry of Health's support for HIV self-testing, they were keen to launch it in August of 2016. And so here, the director of the HIV program, the US ambassador, all self-tested on stage to show their support and endorsement of self-testing and normalize testing in general. So around this time as well, working together with CSOs, there's a lot of effort, which is still ongoing, to promote self-testing through social media, through Facebook, through Grindr and Blue, events and face-to-face engagement. So now I want to share some key results from that evaluation. The majority of those who opted for self-testing as part of this initial evaluation were MSMs, around 90%. And so here I'm showing results among MSMs since they were the majority that opted in. And so you can see that more than half had never tested before. This was the first time they'd ever tested for HIV, and that's a really critical point around the value of self-testing. Secondly, we also asked qualitatively why self-testing, what was the experience like? And there were three key messages. The first was confidentiality. That's why they sought a self-test. The second had to do with convenience. It was easy and fast. And the third was comfort. Going to a peer, going to a CSO that they trusted was comfortable to them. So we also looked at age, and among the MSM that opt for self-test, you can see they were very young. They were largely between ages 20 and 30. And then just one other thing I want to say, and I don't have the slide up here, but we also looked at preference between the blood-based and the oral test. And we actually found it to be about half and half, so essentially equal. Really importantly, we also found that HIV self-testing was safe. There were no reports of harm related to HIV self-test use. Also that the kits were reported as easy to use, and users accurately read their results. So this gets at difficulty. And what's interesting is this was the first time we were rolling out self-testing ever in the country. And so here there's reported difficulty with using Determine, and we expected that. It's not easy the first time you test to draw up 50 UL blood in a capillary. And then there were also some challenges as well with the finger prick and for oral testing with doing the oral swab. Now we've done subsequent analyses of difficulty of use, and we find in fact difficulty has dropped significantly. However, despite reported difficulty, the concordance, the reading from the user versus the trained observer, was 97%, so very high levels of concordance. And that was among those that opted to share the results, so the Determine users around 90% and around 82% for the OraQuick users. So now I want to share some results among people who inject drugs and their sex partners. So we did a study in Vietnam to look at this because as we were looking at the literature around people who inject drugs, found that there really weren't any studies at the time when we did our literature review. And so we weren't that well informed. The first study we did was mostly MSM opted in. And so we really wanted to look then at access and preference. Do people who inject drugs want a self-test kit, and would their sex partners? So in Vietnam, most drug users are men. And so that's why it says male injecting drug users and female intimate partners. So we looked at acceptability, feasibility, and then we did a head-on-head comparison between facility-based testing and self-testing. You know, if you were offered a choice, what would you go for? What would you prefer? So we used a cross-sectional survey, observation of testing, and also qualitative interviews. And there's a lot of results from this study. There was a poster at Mexico City, and I'd be very happy to share it with you. But I want to say here, remember with MSM how more than 50% had never tested before when they opted for a self-test? Same thing among PWID and the female intimate partners. So something very similar. And then facility-based, it was lower. It was 23% who had never tested. And then we looked at factors which were associated with opting for a self-test, and it was, surprise, it was also never having had an HIV test before. So that tells us something very important. You know, 2 different studies looking at populations that are seeking a self-test, and it's clear that in Vietnam we're reaching people who otherwise might not have tested before. And then we asked about future preferences for testing, and here you can see very few said that they would want to go to a facility in the future or seek testing from an outreach worker. And then we looked at 3 different options, test privately or test observed by a healthcare worker, or test privately but maybe with some assistance if you needed it. And so you can see largely there was a preference for maybe a little bit of help or observation. But then when we look at rural and urban, you can see here that there's big differences, and maybe this isn't really a surprise, but in urban areas there's stronger preference for privacy. So now I'm going to switch to phase 3. So phase 3 is really looking at national scale-up of HIV self-testing. So here's the timeline, and in red, here are all the moments for self-testing as it went from a pilot and then to part of the national program. So in 2018, in April, the government of Vietnam adopted self-testing as a normative national approach. Self-testing was also included into the Global Fund concept note with planned coverage for 33 provinces in Vietnam. And then also importantly, it's not just national guidelines with self-testing, there's also other legal elements that might be different in each country to facilitate access to self-testing. So in Vietnam, it was very important to get approval from the government of Vietnam to be able to distribute and to sell self-test kits if you were a CSO, a social enterprise, a private clinic, or something else, some other category. And so that happened in September last year. And so what I want to do now is share some cumulative data with you. So this is just for USAID Path Healthy Markets. It's not all efforts in Vietnam, but it is a relatively large contributor to testing. And so here, as you look at self-testing, you see yield is a little bit higher than lay testing. You see that ART enrollment is a little bit higher than lay testing, 94%. But you also see that use of self-testing is dramatically lower than lay testing. So why is that? So that is an artifact of a major challenge that we've had in Vietnam related to supply. We have very strong demand, as you've seen, but we have challenges with supply, and I'll talk a little bit more about that in a moment. And then again, as we look at users currently for self-testing, you can see that the majority are still men who have sex with men. And so there's a lot of work that still needs to be done in increasing access to self-testing among other populations, if that's what they're interested in seeking. So now I want to move to phase 4. So with self-testing, the market is new, right? Self-tests have not been around for a very long time. It's not like the professional use market. And so what that means is as you're scaling up self-testing, you're also, in a way, having to engage with the market and market dynamics. And so we've done 2 different elements related to market development in Vietnam. One has been to work with Wits University, Gates Foundation, and others to assess or do product evaluation of new products that are seeking WHO pre-qualification. So we've done that with ChemBio, with their SureCheck product, which is really great. It's been very favorably reviewed in Vietnam. The second is OraQuick, who I'm sure you're very familiar with. And the third is Insti, and Insti, we're so happy. Insti just got registered in Vietnam in July. So a big celebration in Vietnam for the very first self-test kit to be registered in Vietnam. And I will say that I'd be interested to hear from the rest of you, but this is a pain point that I perceive is felt in other countries as well, is getting a product registered. And so now I want to move on to phase 4. So this is the adaptation of models. So as we're looking at rolling out different models, one is really through service providers. So that's self-testing through KPCSO, through clinics, or through secondary distribution. And then also through online, through mail order and delivery. And so for mail order or delivery through online ordering, there's a lot of great examples in Asia. There's fantastic work that's been done by Dr. Tang in China, great work by the Thai Red Cross, by linkages. So I think there's a lot of promise for online distribution, and this is an area we should definitely be looking at scaling in the future. So this is a small pilot. Here, 100 kits were distributed after an online risk screening. There was a random 10% follow-up of those who ordered a test. 2 were positive, so 10%, and then they confirmed that they had been diagnosed and ART enrolled. So now I'm going to focus on challenges along the way. So one of the challenges is that in terms of legal framework, you might have national guidelines, you might have products registered, but if pharmacies are not allowed to sell test kits, that's another barrier in terms of distribution. So we're in the process of working with Ministry of Health to change that legal language to enable pharmacies to sell self-test kits. And so far, no significant barriers. This is moving along. But what's exciting about this is it's opening the discussion about what else pharmacies can offer in Vietnam to make them more comprehensive in their service delivery. The second piece then has to do with supply. Because we did not have a product registered in Vietnam before, it meant that we had to do an aided good import. So that is a special process, and it's very time-consuming and very complicated. And unfortunately, that did lead to stockouts this year. But I'm very relieved and happy to say that the test kits are approved now and are in country now and are rolling out again. So there's OraQuick and Insti that are now available. So where to from here? A strong focus on those pharmacies and enabling legal sale through pharmacies. The second is enabling other manufacturers to register their products in Vietnam. So there's choice and competition. The third is working with Ministry of Health to advertise where you can get a self-test kit. And the last is continuing to diversify models and make sure that populations that we don't see self-testing, that they're able to access them. So that includes transgender populations, people who inject drugs, and older MSM. So in conclusion, if this hasn't already come through, number one, in Vietnam, HIV self-testing is safe, it's acceptable, it's easy to use, it's used by those who have never tested before. It's preferred over facility-based testing, where we've done studies to look at that. It results in high ART uptake, and it's a portal to PrEP as well, looking back to Dr. Nitya's presentation. So I would like to acknowledge the leadership and forward thinking of the Ministry of Health in Vietnam. It's been really fantastic to work together with them on this, with the amazing CSOs and social enterprises and clinics that we work with USAID, CDC, my colleagues at PATH, Gates Foundation, Wits University, UNAIDS, WHO, and IES.